Probably didn't, someone hasn't made a comment yet.
If you're in San Jose, it's just like Smith.
Right.
I only know because my wife copied me. So, yeah.
Welcome to AT&T's teleconference service. Please enter your access code, followed by the pound sign. To join the conference as the host, press star. Please enter your host password, followed by the pound sign. There are 11 participants on the call, including you. You are joining your conference as the host. For a menu of available commands, press star pound.
Yeah, I saw that. Well, here's the thing, it's on our network, it's not right here. So you have to build a whole firewall or add their IP address to get into it. So, yes, I will handle that.
Exactly. Yeah. I'll float around. That's good. That's cool.
We love that area.
Birthday. You know, the street.
Oh, it is?
Around
Where is she?
Yeah.
Yeah.
Right.
There's
It was, great area. Okay.
She's on the road back up to the
She's the only house on this bill?
I thought you
Oh, no,
were-
Rick, she's on Brittany, okay. I'm on Regent.
the one before. I think Alice is on Brittany. What street are you on?
She's on Canyon. I'm on,
Scottsdale.
Cambridge.
I'm on Regent, so you can visit.
Oh, yeah? Oh. I think that's where we got our dog.
You want a house in Tucson?
No.
I only saw one.
Mine.
That I saw in the guy.
We have three. We're like on a half acre, so I can.
But the neighbor right behind us. I have two dogs and they're really nice dogs.
I have nobody with me.
Right. Up to my fence. All the way as far from there.
Oh.
They can't.
Ours is. I'll let you guys.
It would be this one.
No.
She's very nice.
Just kidding.
Well, I heard that. I was going to ask you last time. I'm still okay. I keep saying no. You were saying last time. Or I heard. Did your inside exchange?
Good morning to everyone on the phone. Thank you for joining us. Give us just a moment and we'll get started. As a reminder, if you're dialed in, please put your phone on mute so that we don't hear your background conversations. Thank you. Someone will still do it.
Yeah, and then it'll be whole.
Yeah, right, yeah. They won't put us on mute, they'll put us on hold again.
Right.
I looked when I bought my house, they were both for sale.
That's her
I know,
reversal.
it was
Society is
midday.
finally reversing themselves.
And I can still remember that when I was a kid, in kindergarten.
You have to be
We
in
used to
all.
have to put pink and
You
blue
have to be
crepe
in and
paper
out,
on
and you
top
have to
of
be
Well,
those.
there's the argument about guaranteed availability and all this. See, Silas came out and said, if you have one on the inside, it has to be available to anybody that runs out.
We used to have to
And now they've reversed it. It's only true in Vermont, because in Vermont, they don't have
Crazy.
that.
And same with Washington DC.
But I liked it.
Yeah, but other than that,
So,
No, it is.
So
They've
they
done
back off
some
that
beds. They've either
okay.
changed the beds or.
See how
The one that
worried
watches the money.
Something different.
Hey.
Do what you need
Red
to
Sox
do.
man, hello. How you doing?
I've heard her since
I'm the one that watches whether or not we will be decertified because we're not providing enough
I
coverage.
understand, but the other carriers are much wealthier.
I know. I get it.
Hi, John.
I feel like I'm in between the dock and the boat, and I got one rope in each hand, and I'm,
No bumpers.
no, the concern is I can't keep them together. I'm trying to,
How are you?
yeah, no bumpers.
Are you talking on all the plans for Fiscal Academy, DOI?
You mean, oh, I guess, yeah, I'll wing it.
Okay.
What do we got going on here?
Plan certification, network adequacy, and follow-up.
And these are questions that we received specifically related to network adequacy.
Okay. Good morning. Thanks for everybody for waiting while we got everybody on the phone. Welcome to the May 1st carrier onboarding meeting. We're recording here, yeah. So that everybody understands what we're doing. Today we're talking about network adequacy, plan certification, and some follow-up items. We have members. We have 3 members of the DOI here. Expert members that came up with the network adequacy standards that the board approved last week or the week before, last week, the day that we posted it. We will start. So I think we posted an item. Let's see. I guess we'll start with network adequacy. So we posted the network adequacy standards online. And I guess, I don't know if we follow, you have anything that...
Well, I would say let's go ahead and start with roll call, and and we'll do some introductions, and then we'll jump into our network adequacy, plan certification, and follow-up items.
So that's why I have Chad here to keep me honest. So Hometown Health is here in the room. Who do I have on the phone? One representative from each carrier, please.
Anthem is here.
Anthem?
Beth Health Co-op.
Co-op?
Guardian Insurance.
Was that Guardian?
Yes. Coventry Healthcare.
Coventry?
UHC Nevada.
UHC.
UHC?
Liberty Dental.
Liberty?
Health Plan Services.
Health Plan Services? Anybody else? All right.
So we'll go ahead and start with some introductions here. As John mentioned, we have a couple of individuals from the Nevada DOI. I want to recognize their attendance.
And in the back is Glenn Shippey, Cliff King, and Kim Everett. And I think everybody on the call pretty much knows who they are. And then up here we have Chad Hogan and Steve
Wynn.
Wynn, that's right. Sorry about that, Steve. He's just Steve to me.
The usual suspects up front.
He's just
here.
Steve to me. All right, so we have posted the network adequacy standards and a plan certification checklist. So I think first we'll talk about the network adequacy standards. We went through these at both the committee meeting and the board meeting and didn't get a whole lot of comments. I also understand that these were vetted with the carriers in quotes. I don't know if that means everybody, but generally industry has seen these. These are not network adequacy standards for dental plans, and we are working on those at the exchange and hope to have those posted on Friday, or at least a version of them for draft for the plan certification committee meeting that will be held on Thursday morning next week, and then the board meeting that will be held Thursday afternoon. So it'll be a quick turnaround. I don't think you'll see anything too surprising in those, but if you do, when we post them on Friday, please let us know, and we will try to adapt and overcome and make it work. The standards that were posted for the board meeting last week, or the week before, whenever it was, maybe it was 2 weeks, no, it was last week, sorry, last Wednesday, did not have any changes to it. The board approved them as is, and so the ones that you see in, here are the ones that we're going to go forward with. If you recall, we had to do this because the DOI does not yet have the legislation in place to be able to regulate this. So these currently legally only apply to carriers within the exchange, to qualified health plans, excuse me. However, it is our intent. Well, can't say I speak for exactly for the DOI, but the plan has been that, assuming legislation is approved in the next month or so, and then they move into the regulatory process, that it is likely, with a very high percentage of likelihood, that they would approve the same standards for the entire market. So these apply to the entire market, small group, large group, individual, yes?
QHPs.
Right now they apply to QHPs. Going forward, is it the intent to apply to the entire fully insured market?
PPOs, HMOs.
Ultimately.
PPOs, HMOs, whatever else there might be out there, right? Okay. So basically, Section 1 talks about best efforts, emergency services available 24/7. Section 2 talks a bit about the template. Talks about providing an attestation, I believe. Section 3 talks about having in any case where the carrier has an absence or insufficient number of types of participating providers or facilities, they'll use their best efforts to get them or refer to them in some manner. Section 4, again, best efforts, reasonable efforts to include providers, facilities, and networks in a manner that limits the amount of travel required. Section 5 talks about disclosure to covered persons on limitations or restrictions to access. Section 6 talks about American Indians and Alaska Natives people covered under the Indian healthcare system, and potentially using a HHS standard Indian addendum. Section 7 indicates that a carrier that is participating in exchange shall use the best efforts to have a sufficient number and geographical distribution of essential community providers. And it talks about having at least 20% of available ECPs in the plan's geographic area participating in the applicant's provider network, or at least 10% of the available ECPs in the plan's geographic area participating in the applicant's provider networks, plural. And then concluding a justification. Section 8 talks about adequacy of choice being established by the carrier with reference to any reasonable criteria, and includes provider to covered persons ratios by specialty, primary care provider to covered person ratios, geographic accessibility, wait times, etc. Section 9 talk about participating provider availability and accessibility standards. And then you get into specifics regarding primary care providers, OBGYN accessibility standards, very specific standards for urban, rural, and frontier counties, urgent accessibility standards. And you'll also notice that that the telemedicine for each of these, telemedicine may be used in order to provide accessible care to meet the above network adequacy ratios and travel standards. Emergent accessibility standards, mental health and substance abuse accessibility standards, specialty provider accessibility standards, and then Section 10 talks about the goals of the network adequacy program and the requirements in Section 11. One question that we received, there was a question on which essential community provider list that we would adopt, and we had not considered that. We will talk about that with the DOI and try to come up with a reasonable decision for that. Obviously, to be able to meet the 10 or 20% standard, you need to know what the denominator is before you can determine whether or not you met that target. So we recognize that. We'll talk with the DOI. Glenn, you got that? Taking notes for me for that one. So we'll talk about it with the DOI and get back to you hopefully next week. So with that, are there any questions about network adequacy?
Hi, John. It's Claudette Bond with Hospitality Health. I work for Nevada Health Co-op.
Hello. Go ahead.
Hi, can you hear us?
Yes.
My question is, if we end up meeting some of our volume needs by using centers of excellence or programs in other states, will that conflict with what you're trying to set up here as the oversight of this?
I'm going to ask somebody from the DOI to come up to help us out here.
No.
In-state.
Can you hear me from Bobette? This is Kim Everett. Can you hear me?
Hi, Kim. I can. How are you?
Very good, thank you. If there's an exception to your network, or if there's something that is unusual, then part of your attestation would include that. So if you plan on satisfying some of your adequacy needs by using an outside or another state network outside of Nevada, or using a center of excellence, then you would just put that as a notation in your attestation.
Okay.
This document was built to allow for flexibility and for carriers to demonstrate to the commissioner that they did indeed have an adequate network and how they were going to achieve that adequacy. So there is some discretion there.
Okay, that's helpful.
Okay.
And then as long as I've got you, so you don't have to come up again, my understanding is I'm not current on this though, that there's legislation in the Nevada legislature to move responsibility for network adequacy from the Board of Health over to DOI. Is that true? Is that all on board? And everything you're talking about now is going to be DOI, not Board of Health?
That has been proposed as far as network adequacy. There are some other components that we're still in discussion with the Board of Health that has to do with quality. So we're working through those issues with that other agency. But that is our goal, to have network adequacy fall under the division agency.
Okay.
8425.
Yes,
Thank you.
8425.
Yeah, that's Assembly Bill 425.
Okay.
And it's about the last third of the bill.
Okay.
This is Guardian. I have a question regarding the network adequacy. I was understanding that the draft that you proposed was not to impact dental. This was strictly medical, and that discussions for dental were still being, going to be taken back. And I was advised to attend today's call for that discussion. Is that not correct?
That may have been a misstatement on our part. We are talking about network adequacy today for medical QHPs. We do not yet have draft standards for dental standalone dental plans, and we're working on that. Again, we're going to try and post those on our website on Friday for the plan certification meeting that will occur next Thursday. I think it's at 9:30 or 10:30. You need to look at our website for that time. And then we'll also be posted for the board meeting that will occur that afternoon. We recognize that it doesn't give a whole lot of time between the committee meeting and the board meeting. You got lunch to talk it over after the committee meeting, but we also need to get these out to you guys so you guys can start complying with them. I would not expect overly restrictive standards. We realize that this is a challenge for the carriers. It's a challenge for us to do all the things that we need to do here, which is why some of this stuff is a little bit late. And we don't want to discourage participation in the exchange. So, and Cliff King's got something to add.
There's 1,500 licensed dentists in Nevada, and 1,000 of the dental hygienists, for a population of 2.6 million, which puts you into a quandary of how do you get adequacy out of that. It's a real challenge.
Yeah, so we will.
I'm sorry to interrupt, but this person sounded really far away and I did not get the question. Could you please repeat?
It was Cliff King from the DOI. He indicated that there are
1,500 licensed dentists in Nevada and 1,000 of the dental hygienists, with a population of 2.6 million. That presents a real challenge to get any kind of adequacy.
Yeah, so like I said, we'll be providing some standards, but they will be relatively loose standards. So broad standards, yes. We will. We do not intend to discourage participation in the exchange. We got one more thing to add from Kim Everett.
And again, I would anticipate that when a carrier does submit their network for dental, that there would be an exception process that you would attest to, demonstrating how you plan to achieve adequacy for the service area that you plan to do business in. So it'll be designed for flexibility. Does that help?
It does, thank you. So next Thursday will be a discussion, not today.
Correct.
Thank you.
And like I said, we're going to try and post that on Friday. If you have concerns about it, please let us know beforehand so we can try to address those. You can address them in public comment. You're always welcome to give public comment. It is better received if it is done in advance, if it's done in advance, and it's also better received if it actually comes from staff. So if you guys provide us with, hey, that's messed up, and we say, you know what, you're right, let's fix it, it'll be much better if we can present it and go forward with it that way. So please look those over and get us your comments as quickly as possible.
Okay, thank you.
Are there any other questions about network adequacy? I would expect nothing less because the DOI put it together, so they had all their I's dotted and T's crossed. So the next thing is the plan certification checklist. This is basically a way for us to keep track of all of the things that are required for carriers. This was compiled off of basically 45 CFR 156, which are all the requirements of carriers, and then I believe it's the 155 1000 series that talks about network adequacy and the things that the exchange has to do to certify a carrier. In general, there might be some additional items in there, some rating things, some things from the Public Health Services Act, but generally where it comes from are those two sections of the regulations. So obviously we provide a place for carrier information on the first page. We've basically broken it up into several sections. The first sections are the carrier requirements. You've got basically you have something that a carrier will have to do as a carrier, not necessarily for each of its plans, but all together as a carrier. You cannot be on the exchange unless you offer a silver and a gold plan. So that's a carrier requirement. And then there are product line requirements. So HMO, PPO, checking the network adequacy, checking the various things about the product, which will impact multiple plans. And then you get into the plan detail itself. So the page 2 is the carrier requirements that are certified by the exchange. And these surround the technical requirements to basically get your product on the exchange. If we can't get your information into the web portal, we can't offer you as a offer that plan as a qualified health plan, and then it's no longer a qualified health plan because it's not offered on the exchange. No matter what the DOI does with the certification, if it's not offered on the exchange, it's not a qualified health plan. And I think you all are on these meetings because you want to offer qualified health plans on the exchange. At least I hope that's why you're here. It's a very, very positive hope, I suppose. So the enrollment process, the first item, enrolls a qualified individual when the exchange notifies the issuer that the individual is qualified individual and transmit the information to the issuer. So basically you can accept our 834 file and our 820 file, accepts enrollment information consistent with the privacy and security requirements established by the exchange, uses the premium payment process established by the exchange, reconciles enrollment files with HHS and the exchange no less than once a month, acknowledges receipt of enrollment information transmitted from the exchange in accordance with exchange standards. So it's pretty simple things. They're all the things that we've been talking about over the last several months, and we don't think that they are We like to think that they're not overly burdensome. We realize there's a lot of time and effort going into this. But once this is done, it's done for all of your plans, and we move on to the next part, which is the carrier requirement certified by the Nevada DOI. And these are, again, pretty much a simple checklist. You need to be licensed in Nevada. That, I think, is pretty common sense, and it tells you what you're licensed as. That you're authorized to offer health, dental, or vision, depending on what you're offering. And we're still working on figuring out what's going to go on with vision. So we'll leave that to another discussion. But definitely for those of you on here, health and dental, that you're in good standing. And so is the applicant out of compliance with any applicable Nevada solvency requirements for the calendar year in which you're applying to be a QHP? Is the applicant currently under any corrective action related to financial review? I don't know if that box were to be checked that yes, you are under some issue. It does not necessarily mean that you can't be a qualified health plan, but the Division of Insurance will be reviewing that to make sure that the appropriate actions are being taken to ensure that you could in fact offer plans. And I think this is less a matter of simply being a qualified health plan, but rather, can you offer plans at all? Can you stay in the Nevada market? Maybe I'm overstating that a little bit, but the intent is not to say, yes, you got an issue, you're out. It's to say, yes, you got an issue and you're working on it, and we think that you're working on it in good faith. So it's just a matter of making sure you're moving forward appropriately. So page 4. You offer through the exchange at least one silver and one gold plan. You comply with the Nevada marketing laws and regulations. Marketing practices do not discourage enrollment of individuals with significant health needs. Issuer logos submitted in 2 formats. Actually, I'm not sure why that is in the DOI item. That probably should be in the exchange item. But in any event, you do need to provide us some logos so we can put them on our website. What's that?
It comes through the surf binder, so that's why they do it as part of that process.
That's why we got smart people here answering my questions. So then transparency requirements on page 5. The carrier makes available the following in an accurate and timely manner in plain language to the Commissioner of Insurance, the exchange, the Department of Health and Human Services, and the public. And these are all required by 156-220. The documented description of claims payment policies and practices, periodic financial disclosures, data on rating practices, information and cost-sharing payments for out-of-network coverage, information on enrollee rights under the Title I of the ACA, including insurance market reforms and patient bill of rights. And then by signed attestation, data on enrollment, data on disenrollment, data on the number of claims that are denied. On page 6, carrier makes available the amount of enrollee cost sharing for specific items or services by a participating provider in a timely manner upon request of the individual. Makes available such information through the internet website and other means for individuals without access to the internet. And this is verified in the summary plan description, evidence of coverage, and in SURF. And then also in transparency provides required notices on internal and external claims appeals in a culturally and linguistically appropriate manner, and you provide the sample notice. Actually, at that point, I'm going to go ahead and pause here for a moment. Are there any questions so far?
This is Frank Howell from Coventry. I just have a question. Just generally, there's a attestation on the NIC websites as we do our binders, and I assume you want us to use your attestation rather than any others that are out there. Is that correct?
Yes, Frank, this is Glenn Shippey, and we will have our own set of attestations, and we'll make those available. If we haven't finalized those yet, and as soon as we do, they'll be available in SURF. If we receive a binder before we finalize them, then we'll send that document out to that carrier to just complete and then return back to us.
Okay, thank you very much. Thank you for that clarification.
Any other questions?
I have a question.
And who is this?
This is Raj from Coventry Healthcare.
Go
So
ahead.
for the periodic financial disclosure and for the providing the enrollee cost sharing, would the exchange be providing us a list of specific reports does it need to provide all that data?
Are you talking about the items that are in
5.1.
5.1? I don't think we have anything specific in this. I don't think that...
Information on cost sharing and payments for out-of-network coverage, those kind of dollar amounts. So I'm assuming there will be a list of reports that we have to provide to the exchange.
That's correct. So there's a list of reports that we addressed in the, I believe it was last week's meeting, that we're still working on in regards to reporting requirements. We're building out the requirements for what pieces of information that will be required for each issuer to provide to the exchange.
So can you provide an example, Steve?
Example of so in regards to data on enrollment, disenrollment. So that information will provide a template for what pieces of information that we need as we go through each one of those reporting requirements established by the ACA and determine how that information needs to be passed on to the exchange. So we haven't reviewed that in detail yet. So as we continue to evaluate that, if you have suggestions and current reporting that you would like to provide to us to review, we'll take a look at that as well.
Any ETA on this?
We'll get back to you on the time frame. We have to discuss it with internally. So.
Okay, thank you.
We recognize that we are butting up against that June 7th deadline. We will work with you to make this work for everybody.
Okay. So that, I'm assuming that that is a definition of the usual and customary that's going to be used for out-of-network calculation. That one thing, that if I was reading that in the law, that's what I saw.
The information on cost sharing and payments for out-of-network coverage?
Correct.
Yeah, that makes sense. Does, just putting them on DOI on the spot, does the DOI have any idea of what they were expecting for these various items? Or was it a matter of getting information from the carrier saying, yeah, that makes sense, that's comprehensive enough, or no, let's go back and ask the carriers to provide a little more information? How did you, do you have any specific standards for those items yet?
Not yet.
Not yet.
We'll work together to figure this out.
It's a work in progress. So, you know, one of the difficulties that we've had with CMS is that they're providing us information at a late notice. But if you were to look at it from their perspective, they put something out, and then people have concerns about it. Carriers, exchanges have concerns about it. They go back and fix it based on those concerns, and it ends up getting out to us fairly late. And we're kind of in that same boat. We understand that as the state agency, we're putting things out. They're not always perfect, and it's a discussion with you guys to make them better. We're not going to get this right. We're not going to get this perfect for June 7th. We're not going to have this perfect for October 1st. And we all, you know, I appreciate everybody's patience while we understand that and make it work to the best of our abilities and improve this as the years go on. This is going to take quite some time before this shakes out and we make a process that is perfect. Well, it'll never be perfect, but better than it is today. So please bear with us and keep providing your input so that we can make this better for everybody. Anybody else have any question on transparency or the items prior to the transparency? So I think we got through.
We got through section 6.1, starting on section 6, termination of coverage of qualified individuals. Page 6, bottom of page 6.
Okay, so now top of page 7. The carrier terminates coverage only if the enrollee is no longer eligible for coverage through the exchange. The enrollee coverage is rescinded. QHP terminates or is decertified. Enrollee switches coverage during an annual open enrollment period, special enrollment period, or obtains other minimum essential coverage, which is really a special enrollment period. For non-payment of premium, only if they apply termination policy for non-payment of premium uniformly to enrollees in similar circumstances. Enrollee is delinquent on premium payment, provides the enrollee with notice of such payment delinquency, and provides a grace period of 3 consecutive months if enrollee is receiving advanced premium tax credit of the premium and has previously paid at least 1 month's premium. All of the rules that we've been discussing, and by the way, that termination should not come until we send the 834 file to terminate that individual. You could potentially take all of this out there and basically say the carrier terminates it when the exchange sends an 834 file. 6.2 provides reasonable notice of termination of coverage to the exchange and the enrollee. And again, that's I think it's changed since we have.
Yeah, one of the things that we want to clarify here is that as we go through the termination process, the exchange is sending all of the notices that they will be terminated, including a final notice. However, the issuer is still responsible for sending the final notice to the member that their coverage has been terminated and what the effective date of that termination was. Since the issuer or the carrier is the one that holds the contract with that individual from that coverage standpoint, they have to provide that final termination notice. The exchange is accepting responsibility of providing all of the notices leading up to that on behalf of the carrier.
And I believe today we will finalize the termination rules so that you can provide that in your SBCs so that we can validate through the certification.
Now, there was a document that we posted online that was sample evidence of coverage language for enrollment through the exchange. I will say it is by no means perfect. Again, if you read the disclaimer, it says look at it and talk with your legal department, make sure it works for you. I'm sure there are things missing, and we look forward to improving that when we get your evidences of coverage and make it work for everybody. So if you find something that's off or wrong about it, please, again, let us know. But it's a starting point for you to get the things that you may have missed in whatever work you're already doing. And finally, 6.3 maintains records of termination of coverage for auditing. Are there questions about termination?
No, but I have a question related to the notification.
Okay.
Do you have a list of all the notifications that the exchange will be sending, just as a reference?
Yes, that's going to be discussed in next week's meeting. So we have that list defined. Okay. It's a working document as regulations change, but we have pretty much the majority of those documentations outlined. Which ones the carriers will be responsible for, and which one of the exchange will be responsible for.
Okay, great. Then that'll be coming out next week. Okay.
We should be posting that this afternoon for next week's discussion.
Great, thanks.
Item number 7 is a quality assurance program. The carrier needs to implement and report on a quality improvement strategy or strategies used to reward quality through the use of market-based incentives. That requirement is 45 CFR 156-200B5. And the carrier provides in the application report regarding how the carrier intends to implement the quality improvement strategy. Once the Division of Insurance approves it, it is forwarded to the exchange for review at a later date when we have a chance to breathe. The improvement strategy is any strategy that includes increased reimbursement or other financial incentive for, and this is based off of the 42 U.S. Code 13031, improving health outcomes through the implementation of activities that include quality reporting, effective case management, care coordination, chronic disease management, medication care compliance initiatives, including use of the medical home model or for treatment or services under the plan of coverage, implementation of activities to prevent hospital readmissions, and implementation of activities to improve patient safety, reduce medical errors, implementation of wellness and health promotion activities. Now, I will say with the wellness, on the wellness side, wellness programs, as you know, can be designed to improve the benefits for an individual, or they can be designed to reduce premiums. I believe that there is only an allowance for wellness on the shop side. There is no allowance for wellness or smoke tobacco cessation on the individual side, which is interesting. But on the small group side, there is wellness. There is an allowance for wellness and tobacco cessation. The premium, I believe the premium reduction is currently 20%, and it's being increased to 30% by the Public Health Services Act. Now, there's one caveat to that. The 834 files that the FFE uses does not have a place to return that information on wellness. Apparently, we've been the first state to ask the question about how wellness will be determined, or tobacco cessation, not determined. You guys would determine that. The question would be, how would you communicate that to us so that the proper billing occurs? And this is a national issue because premiums are required to be aggregated on the shop exchange. They have not built in that field in the 834 file process, on the return file process, which we realize that we have said that we are not accepting 834s. We're looking at that and trying to determine what is the appropriate process for getting the information that you want to get to us, and whether or not we do that. So admittedly, we're looking at that. The problem, though, we indicated we're trying to use the national file formats so that it is easier on the national carriers, and the national file format does not include all of the information that's necessary. So we're trying to figure that out. That does not preclude you from doing wellness programs that improve benefit design, although I have no idea how that affects actuarial value, or if that does affect it. Maybe it doesn't because it's wellness. I don't know if anybody's looked at that either. But on the premium side, we have to overcome some technical issues for that. So that is out there for you. Another item, since I'm thinking about the limitations of the products that are provided by the national organizations, my understanding is that the SURF template does not allow for, or is not designed yet to allow for age rating for the tobacco surcharge. Is that a correct statement?
The rates template.
The rates template does not allow for a age rating of the tobacco surcharge. So basically, it only allows for a percent, an across-the-board percent increase for tobacco usage. So we're looking at that. I don't know how you get around that, but we're looking at that. Just to throw another thing in the mix. All right, so that was item number 7 and a little bit more. Quality assurance program. Any questions on the quality assurance program or the other items we just discussed? Section 8 is network adequacy. And this is basically what we just talked about, so I'm not going to go over that again. Section 9 is accreditation standards. So the appropriate product line, HMO, PPO, etc., is accredited on the basis of local performance in the following categories by an accrediting entity recognized by HHS. So at this point, I believe it's NCQA and URAC. I don't believe there are any other recognized accrediting agencies. Clinical quality measures such as the HIDIS patient experience rating on the standardized CAP survey, consumer access, utilization management, quality assurance, provider credentialing, complaints and appeals, network adequacy and access, and patient information programs. Now, let's see, authorizes the accrediting entity to release to the DOI Exchange and HHS a copy of its most recent accreditation survey and survey-related information, accredited within the time frame established by the exchange, maintains accreditation. So that last item in 9.3, the idea behind that one is some of you are not accredited yet, but intend to. The board has determined that we will give you, I believe it was 2 years, to get that accreditation from July, from when you submit the plans, I think is what, something like that. Hopefully it will be earlier, but that's how we're going about accreditation at this point. So you have a little bit of freedom in there for the first year or two on this one, but we hope that you'll be accredited as soon as possible. Anything to add on this one? Any questions? So items. So item 1 was the meeting the exchange certified carrier requirements. 2 through 7 was meeting the DOI certified carrier requirements. 8 and 9 meet the certified product line requirements. And then we get into the specific items, the items that are specific for plans. So the intent, again, was on those previous items, we check it once for a carrier. We don't check it multiple times, kind of makes it more efficient on our end. And then we can fall back on those items in the future. So item number 10, benefit standards and product coverings, covers the essential health benefits package. Plan meets one of the metal tiers, non-discriminatory benefit design, and this one, obviously, plan to benefits design shall not discourage enrollment of individuals with significant health needs, is prohibited or discriminated based on an individual's age, expected length of life, present or expected disability, degree of medical dependency, quality of life, or other health conditions. And I believe that's straight out of Public Health Services Act, which is now codified in 42 U.S. Code. I don't know where it's codified at. Don't have the reference for that, but you guys have heard it before. Meaningfully different plan designs. 10.5 complies with annual limitation on cost sharing, and cost sharing shall not exceed the dollar amounts in effect under the Internal Revenue Code for self-only and family coverage. And for SHOP, complies with annual limitations on deductibles for employer-sponsored plans. If it's a catastrophic plan, it is only offered to eligible individuals eligible to enroll in a catastrophic plan, and we will determine that on our end, but that information is also there for your direct enrollments outside of the exchange. And that those rules include that individuals have not attained the age of 30 before the beginning of the plan year. Individual has a certification in effect for any plan year exempt from the shared responsibility payment by reason of lack of affordable coverage or hardship. If offered, catastrophic plans are offered only on the individual exchange and not on the SHOP exchange, and the catastrophic plan complies with the specific requirements for benefits. For silver plans, they also must offer the silver plan variations at 73% AV, 87%, and 94%. 10.8, we are reviewing that right now. The current regulation, I believe, says that all plans, you have to have a tribal cost sharing variation at 100% AV. However, there has been some guidance that was issued that said if you've got the same network and benefit design, basically everything's about the same about the plan other than the cost sharing, it shouldn't make a difference, because those, if they're at 100% AV, they would be the same plan design. And so the idea would be that if you have a group of plans with the same benefit design and same network, etc., and the only difference is the cost sharing. So let's say they've got a platinum, gold, let's say you got all four, platinum, gold, silver, and bronze, that you would only have to provide the 100% AV plan for the bronze plan, because the individual would choose the cheapest plan with the same benefit design. We need to look at that from a technical perspective, and we need to look at that with the Division of Insurance still. I believe that information was provided in connection with the federally facilitated exchange. But again, we're looking at that, and hopefully we will have some guidance for you soon, but I agree it would make much more sense if we can make that a little more efficient. So again, looking at that one. 10.9, you need to offer a child-only plan at the same level of coverage as any other plan that you offer through the exchange. So basically every plan has to have a child-only plan. 10.10 does not have benefit designs that have the effect of discouraging the enrollment of individuals with significant health needs. Submits a description of covered benefits and cost-sharing provisions to the exchange at least annually, complies with internal claims and appeals and external review processes, makes its provider directory available to the exchange for publication online in accordance with guidance from the exchange and to potential enrollees in hard copy upon request. Provider directory identifies providers that are not accepting new patients. And I believe those are all requirements of 45 CFR 147, 136. And I believe that those are required to be provided quarterly. Isn't that a division of insurance requirement at this point? We would like to be able to update our systems quarterly as well. I'm not sure exactly how the format is going to be provided. Is it?
We have a file that we'll be posting today for the details of the data that needs to be collected.
So we'll be posting that at the bottom of the carrier onboarding page.
Correct.
And we can take it more frequently than quarterly.
We can.
Be happy to take it more frequently so that our consumers are aware of the current status of your networks. Let's see. So I'm going to pause. I'm almost done here on 10.4. So 10.14, plan premiums are submitted with the following separate categories: premiums allocable to APTC, premiums allocable to the state, and premiums allocable to the individual. So we've talked about this before, but premiums allocable to the APTC are basically essential health benefits. Premiums allocable to the state are state mandates, which we think are none at this point. The two bills that potentially provided a state mandate and an increase in cost were the autism bill and the acupuncture bill. Both of those did not make it through the first committee. But as you know, anything can be resurrected during a legislative session, so we're keeping our eye on that. But as of right now, there are no state mandates. We'll let you know if we hear differently. Premiums allocable to the individual, I believe those are non-EHB, and then abortions for which public funding is not available. And I assume that your actuaries know what that means. I don't, but I'm not concerned about that because you guys will figure that one out. And that, again, is straight out of regulation and statute. So are there any questions so far on item 10? All right, moving on to item number 11, rate filings and other rate disclosure requirements. You need to file rates for prior approval, submit rate information to the exchange at least annually, and that is done automatically through CERF, through the plan certification rate review process. Submit to the exchange a justification for a rate increase prior to the implementation of the increase. And when we say the exchange, in this case, again, the DOI is doing rate review, so to the DOI. Prominently post the rate increase justification on your website, on the carrier's website, prior to the implementation of the increase. Actually for the DOI, prior to the implementation of the increase, does that mean on October 1st they could do that? Or does that mean December 31st? Or does that mean, I can't imagine it's prior to you guys reviewing the rates, or is it?
Well, this justification, let me just speak about this broadly. What our bill AB 425 is going to require, and hopefully it'll pass, and I think everyone will be pleased with that, but will require all three parts of the rate filing justification for all individual and small group non-grandfathered rate filings. Parts 1 and 3 would be kept confidential, so they wouldn't be exposed, they'd be protected. Part 2 is the consumer disclosure piece, so that would be the part that would be exposed. So when a carrier would submit a rate filing, it would be posting that disclosure that would satisfy that requirement. That's how I interpret it at this point.
Thank you. All right, so then moving on to any other questions about rate filings and other rate disclosure requirements? Moving on to rate standards. Sets rates for an entire benefit year or for the shop for a plan year. Rates must be the same for products inside and outside the exchange. Moving on to allowable rating variations, that it varies only based on geographic area, the 3-to-1 age ratio, the tobacco use 1.5-to-1, and family composition. And since we're almost done, I'm going to keep going. Applications and notices provides to applicants and enrollees all applications and other material in plain language and in a manner that is accessible and timely to individuals living with disabilities and individuals with limited English proficiency through the provision of language services at no cost to the individual. And then finally, number 15, other reporting requirements. Reports to the USDHHS on prescription drug distribution and cost. The following information paid by the PBM or issuer. And for us, you're going to provide us an attestation that you're doing that. Percentage of all prescriptions that were provided through retail pharmacies compared to mail order pharmacies. Percentage of prescriptions for which generic drug was available at dispense compared to all drugs dispensed broken down by pharmacy type. Independent pharmacy, supermarket pharmacy, and mass merchandiser pharmacy. Again, these are requirements straight out of the federal regulations. Aggregate amount and type of rebates, discounts, or price concessions that the issuer or its contracted PBM negotiates that are attributable to patient utilization and pass through to the issuer. Total number of prescriptions that were dispensed. Aggregate amount of the difference between the amount the issuer pays its contracted PBM and the amount that the PBM pays retail pharmacies and mail order pharmacies. And that is all of it. As you see, there are we tried to reference where we could everything, and I think we missed a couple of spots, but these really are federal requirements. There's a little bit of state requirement, but very, very, very little. It's mostly straight out of the regulations. Are there any questions about the process that we're going to go through to certify? And when I say we, I mean the DOI. Thank you, DOI, for doing this for us. Is there any questions about the process that the Division of Insurance will be undertaking for us to certify your plans? Any concerns? Excellent. So obviously we got a couple things we still got to work on, but we're getting through that process.
All right, very good. So a couple of follow-up items that we had as some takeaways from our last carrier onboarding discussions. Some of these come right out of last week's session, come out of the session prior to that. But they were items that were discussed amongst the carriers and the exchange. And we thank you for that dialogue. It gives us an opportunity, as John mentioned, to go back and look at the policies and work with you, the carriers, to come up with recommended processes that work for both the exchange and for the carriers. So a couple of follow-up items that we wanted to touch on. The first being the carrier's appeal process, followed up by a look that we took on retroactive termination, and then some more details around employer and employee eligibility. So on our carrier's appeal discussion last week, we wanted to foster some communication about this. This is a process that the exchange was looking at as a vehicle for carriers to communicate concerns around the eligibility of a member for various reasons. So we had put out in the slide deck for carriers to come prepared to kind of discuss a few topics around general eligibility, broker misconduct, fraud, or any other specific areas that a carrier may want to appeal to the exchange because they believe that there's some concerns around the eligibility of a member for coverage. So that kind of overview was on slide 7 if you're following along in PowerPoint. Moving on to slide 8, we wanted to kind of start and talk, and it's a good thing that we have the Division of Insurance here today, because we can talk a little bit collaboratively about broker misconduct, and if the carrier is looking to appeal to the exchange a case of broker misconduct. And really, we wanted to understand how carriers today handle that, specifically in regards to appointments, commission vestings, and any future ability to represent their products. So kind of would like to solicit some feedback from the carriers on the phone or here in the room.
Free reign to do whatever we want.
I think people are probably uncomfortable to talk about discipline of brokers, since every company probably handles it differently because of the potential retaliation of the broker community.
Okay.
So we can always call you directly, John, and talk, right?
Yeah, absolutely. So please let us know what you do. So we may not know that you have had some kind of action against a broker. I don't know if the DOI would know about it. I think that does the DOI always know about it when you do some action against a broker?
At least on the CMS side, we're required to notify the DOI, and there's a communication between the DOI and us on if there's action taken to unappoint.
And maybe
but that's not necessarily a disciplinary action. That may be a business decision to unappoint.
Okay. Could a carrier unappoint one broker, but another carrier may not? I would say that different carriers can appoint or unappoint different brokers. And you all have your commission structure. I think you have to get an appointment to get a commission as a broker. I don't know. I would assume that the DOI know. Does the DOI keep track of the appointments?
In agency licensing, yeah.
Okay.
We don't in our section, but in agency licensing.
All right. So, but there is okay. So you do keep track of that.
Process.
We have to pay. I think it's $15 or $20 per appointment.
You pay the DOI per appointment, and so in the exchange, you need to realize that the broker is going to come to us, and we're going to give them a login to enroll products in the exchange. And I don't know what the process is, or if there is a concern. All the products in the exchange will be open to individuals. If a carrier comes to us and says, we want to enroll somebody, if we don't have any reason to not allow them to enroll, or to be a broker on the exchange, I think we have to. And one carrier may treat a broker differently from another carrier, but that broker is now enrolling people on all products on the exchange. They may not get commissions from one broker, but if you as an individual come to a broker to get coverage, and the broker says, here's the products that we think you should enroll in, and of course they want to get a commission, they also have to disclose that there's these other products that for which that broker does not get commission and has to allow the individual to enroll in those products as well. Are there concerns about that process, and how do we overcome those concerns?
Well, if the broker is not going to get a commission from the carrier, I think his opinion will be very biased, and he will not advertise for the other products then. He would not recommend.
I agree completely, and I can't say that they will all disclose to individuals that all the products are available on exchange. They're required to, but I understand requirement, and what is actually done is different. But the broker is required to let the individual know that there are other products other than the ones that they might be steering them to. And so there is a potential for an individual to come to a broker, and that individual enrolls in a product for which that broker does not have an appointment on the exchange. So I agree that it will generally take care of itself, but the possibility is there. And so the question I have is that a concern, and how do we overcome that concern? Or is it just there's nothing we can do about it, which may be the case?
that a concern for the DOI in regards to a broker selling a product they're not appointed for?
Is that a concern for the DOI? Is that a concern for the DOI if a broker has an agreement with the exchange to offer products in the exchange and enrolls an individual in a product for which they are not appointed?
Well, they certainly can't be paid for it.
I agree with that. That makes sense.
Beyond that, you know, the idea behind the navigator was to have somebody that would be objective and not being paid by the carrier. But how do you stop, you know, put all the brokers out of business? It's a fact of life.
Well, and the intent is not to put brokers out of business. For any brokers that might be listening on the call.
Sounds like we're okay then.
I think business will boom for brokers. I don't know if we're okay, but there are no concerns being voiced. But if you have concerns that you don't want to voice on the call, please let us know so that we can discuss them with you.
You know, and again, as we go through some of the other topics here, you know, again, we're touching on subjects they're probably sensitive to the carriers in terms of your process and those kind of things. So again, please provide feedback to the exchange as we go through and start creating and setting the policies around these. We want that feedback to make sure that it's works within the market and works for the issuers as well as the exchange. So we did have some questions. We talked about this briefly last week in regards to an individual where the issuer suspects fraud. You know, we briefly outlined a process whereby which the issuer would traditionally terminate the individual, but we have some questions regarding how do you handle pending claims, how do you handle payments, and do you flag that individual against in your system for future eligibility? And if you do you see that in conflict with the guaranteed issue provisions?
Fraud and misrepresentation requires intent. That's sometimes very difficult to distinguish between intent and mistake. Now, a guy that kills a girl on a horse with with his motorhome, and he forgot. It's kind of hard to believe. But other things, you know, it's a judgment call. It's not easy.
So they're not using the CMS definition of fraud, which doesn't require intent? Because for Medicare, you don't have to have intent. Right?
Again, we're putting this out there for discussion.
Well, and there may not be a definition for it, but my guess is the courts will provide us a definition within a couple years.
And I can tell you that, you know, currently, as we know, we have a guarantee issue market for small group. And the Division of Insurance has taken a position that if even an employer that misbehaves and a carrier terminates that small employer under today's statutory scheme, if that employer later on came back to that same carrier under guarantee issue, they couldn't be denied unless there was something new and relevant on that application, but they couldn't be denied the policy based on something that happened in the past. So that's the position that the agency has taken with our existing statutory scheme. I suspect that that's the way it's going to be under the federal rules as well.
So as you're reading it, an individual could be potentially termed for fraud, whatever fraud is defined as, and then at the next open enrollment come right back in and enroll with that same issuer against whom they committed fraud.
I don't see any exception to that right now.
They can decide not to buy it, right? But we still have to issue it.
Yeah, I can't see where you can deny.
Yeah, but today we can max rate them, you know, for other conditions, you know, conditions that we know about.
Yeah.
So we have a way of changing that. If they came in at a preferred rate, now we already know about their health history. we know we're gonna max rate them. In this new world, we're not gonna be able to do that. So it really takes you know, what's the point? I mean, we're not gonna be doing any health history at all. So, you know, that's usually what a carrier does do fraud for, is that they didn't disclose information and we didn't give them the correct rates at the time or decline them.
So, and with our checks that we have bouncing off the Federal Data Hub, I mean, theoretically, I mean, unless you've stolen somebody's identity, for the most part, the information should be pretty accurate. So, are there other instances of fraud? I mean, I know you could do on the carrier side, you can have potentially you could have somebody that submits a claim as an out-of-network provider and somehow, but that's a little different. I mean, so are there any other reasons that you would terminate an individual, an enrollee for fraud?
Well, what would happen if you had, since you're only allowed to write for 3 children under a certain age, okay, and somebody decided to cover their neighbor's children because their premium was already maxed, or their nieces and nephews,
sure,
because their premium was already maxed out at the 3 children under the age of 19.
Right.
To me, that's a fraudulent act, you know. So we would assume that we would have the right to terminate those people for not meeting eligibility requirements on review. Is that a reasonable assumption?
Right, so in that case, that's where the appeal would come into the exchange, where you would say, we believe, based upon what we've seen here, that these dependents should not be eligible for coverage, and submit the appropriate information for review to the exchange to determine that eligibility. Because we'll have to go back and look at various data sources that we received that the issuer or carrier may not have purview to determine whether or not that appeal of eligibility is in fact true, or if there are other items there that would dictate that eligibility as being correct.
But if those same individuals that you terminated for fraud come back to you during the next open enrollment period, I don't see how we could deny them the opportunity to purchase.
But we could deny the ones that we knew weren't theirs.
Yes.
Yes.
Yes,
right.
yes.
Mm-hmm. Right, so we could deny.
You can act on the information.
That you have.
Yes. But
Can everybody on the phone hear this?
No, someone was keying in the background.
So if you're on the phone, please keep your phone on mute until you're ready to talk, and we'll try to pause where we can to keep you in conversation. So the question was, or I guess it was more of a statement, you can terminate somebody for fraud in the case where you have a family of 5, or you have 3 kids, and they've added additional kids because their rate was maxed out at the 3 kids, and it really turned out to be their neighbor or something like that. You could terminate the entire group for fraud, the entire family for fraud, but you would have to, under guaranteed issue, allow them back on the plan the following open enrollment, although you would not have to add on the neighbor's kid as part of that family. You would still have to offer them the child only or the coverage under that family. So you just wouldn't have to offer them combined. So guaranteed issue makes it a different world.
So if there's any other comments in regarding to the carrier's appeal section, we can certainly discuss them. But I'd encourage each of the issuers, carriers, to look at slide 8. Again, provide written documentation and email back to the exchange with comments in regards to it. Even in regards to processes, how you'd like to see it handled, those kind of things, so that the exchange can establish the policies around that. Again, we'd rather solicit the feedback and then, based upon that feedback, provide the policies versus just creating the policies and then discussing them after the fact. So we're trying to get ahead of this one a little bit as appropriate. All right, any other questions in regards to that? If not, we're going to move on to slide 9 and the retroactive termination for non-payment. All right, so there was several questions that were brought up over the course of a couple of different carrier onboarding sessions in regards to membership management, regards to reconciliation, billing, payments, all around how the exchange would handle terminations for non-payment, what the requirements were around those, specifically in regards to individuals that were receiving APTC. After reviewing the appropriate federal regs, guidance questions from directly to CSIO, input from issuers, the exchange has established a policy regarding non-termination for non-payment as following. So I'm going to read this. Termination for non-payment. Correct. Sorry. As follows. I'm going to read this exactly off slide 9. And then the following 2 slides provide a flow that give the clarification around it. So if, and this is for the APTC individual, if APTC is involved, the individual will be provided a 3-month grace period. If premium is not paid in full by the end of the grace period, the individual will be retroactively terminated to last day of the month for which full premium was received, but no earlier than the last day of the month of the first month of the grace period.
So really the only difference from what we said before, generally they stop paying and they're going to be terminated at the end of the first month of the grace period. However, if you have an individual who starts to pay, let's say that their premium is $100 a month, and so they get to the 85th day and they pay $250, but they don't pay the full $300 by the end of that month, they have not paid in full, and pursuant to the regulations, we have to terminate them, but they have paid 2 of the months of the grace period. So we will retroactively terminate them at that point only 1 month, not all the way back to the end of the first month.
Wouldn't it be cleaner just to reject the entire payment?
So,
because that meant they paid for the insurance as long as they needed it. I think that's where, right.
Mm-hmm.
So basically, they paid for the insurance as long as they needed it, and now they don't think they don't need it anymore, so they stop. So they're not going to pay it. The policy generally is that partial payments do not restore coverage.
So
it's from the right. So
if we reject the payment, then the carrier is not getting anything other than the APTC for that first month, even though the coverage is in effect for that first month.
But wait a minute. This is Alicia. If they make a payment before you terminate them, so you're not actually outside of coverage yet, then you're saying that it doesn't matter, start over from the time, like if they paid January and February, you don't restart it over March?
No, it is not. It is not a moving grace period. It doesn't go with however much you paid so far. So let's say somebody enrolls, they pay for January because you can't get on the exchange without paying your first month. The bill for February will go out January 10th. It'll be due January 25th. If they don't pay by the due date, it starts the 3-month grace period. The carriers will be required to pay claims up through, in that case, February 28th, and then starting March 1st, they can pend claims. The grace period would then end at the end of April, 90 days later, they've missed their 90-day grace period at that point. If the federal regulation says that if they have not caught up, they have not made their payment in full to get to the end of April, then they have not done what they need to do to get out of the grace period. And so the federal regulation says that they shall be terminated to the end of the first month, and that's where you paid the claims. So they would be termed effective February 28th. The carrier would get the APTC for February, but if they didn't pay at all, you wouldn't get the individual's premium. Now, for those individuals that are down closer to the Medicaid side, where down 150% FPL, you're going to have most of the payment through APTC anyways, for the most part. For those that are up closer to 400% FPL, you're going to have very little of the premium amount through APTC. And it says that if you didn't make that payment in full to get all the way caught up to the 90 days, you'll be terminated to the end of the month of the first month of the grace period. So that would be February 28th in this example. Now, I believe there's some flexibility to allow that termination to be later if they've paid through that month. Well, I guess there's some flexibility to be allowed for it to allow to be paid later. And there was concern from the carriers about getting the funds that have been sent to the exchange. And so, based on that input, we thought that you would want to be able to collect a premium, but maybe that's not the case.
I think there could be legal issues if you accept money. If the person pays a partial, let's say they pay 90% or 95%, but don't pay 100%. And then they have some significant bills there, and you're denying that last 60 days of bills. I think that if they get an attorney, you might have things reversed. I don't know. It's getting into a real legal area, but I think that you're altering the provisions if you accept money during that grace period. That's not 100%.
Tammy, our current policy is you have to pay 100%, right? I think every carrier, you have to pay 100% to reinstate back to for whatever the retro enrollment, the retro coverage period is.
Well, the coverage is not canceled, so the coverage is still active. The claims are just not being paid. So if they pay the additional premium, so say in the scenario that was given, they pay in April and they end up paying for March. Okay, so we would apply that. It would make sense to apply that premium and forward that to the carriers and then extend that coverage through March, so that and then open up the claims for March. They would still be in their grace period according to the regs, but it wouldn't make sense for us not to accept that payment and just hold that payment. We wouldn't return the payment if it wasn't in full. We would hold that payment until we would post that payment and then apply that payment, and then forward that on to the carriers. Once they make that payment in full, then they come out of the grace period. If they pay partial at the end of the grace period for any month, we would return the partial payment and they would not have coverage for that month.
I'd recommend talking to your dad.
So then what about when they make partial payment but it covers so you have a 90-day grace period but it covers 65 days of payment? So you're saying that within your company you take the payment for the 60 days for the 2 months and you return the partial payment, like the 5-day payment?
Right, so they're gonna pay. So this was the question that was raised by a couple of carriers during the initial discussion when we originally had said that we were going to terminate back. We're going to terminate back to the last day of that first month, and
right.
The question was raised that if we received March also in this scenario, would we go ahead and accept that, or would we go ahead and retro term and send that money back? And so, based on the understanding that for the benefit of the consumer, I think it would make more sense to keep that money, keep them covered for that month, even though they didn't make that payment.
I think you just said the thing you said for the benefit of the consumer.
Right.
So what I'm now I'm going to ask the question is, are we going on dates of service or dates of claim received? So for the sake of argument, if I have somebody that's quasi-active for that first 30 days that they don't have the payment, right? And I don't receive any claims that month for services in February, and I receive my claims for February dates of service in April, when, or a date of service that's after the grace period, do I have to pay the claim based on the date of service? Or can I deny the claim because of the receive date?
How do you pay it now? You pay it based on date of service, right?
Right, but if the person ultimately was determined not to be eligible during that date of service, at the time the claim is received, the claim is denied because they weren't eligible on the date they received the service. So if the claim came in when they're in the limbo status, then you're saying we have to pay it.
I'm saying the federal regulations say you have to pay it for the first 30 days.
Correct. But you're telling us that they're active for the next period until we have the ultimates. We pay for the first 30 days. Now we have a claim for day 31 to 60, but we don't receive that until after we're sure that they haven't paid.
No, you receive it when whatever schedule that you receive it, but you pinned it until the 90-day grace period is up, and that's regardless of whether we let them on coverage for that second month because they paid that second month or not. And so we have to figure this out. I don't know if we're doing it here today, but apparently there's some confusion of, different carriers want it different ways.
I think our concern is our providers, because if we're keeping them active and there's a potential that they're not active.
There's nothing we can do about that. That's federal regulation.
Well, if the provider calls for eligibility, it states in the reg that you are to inform them that they haven't paid and that they could possibly be.
Oh, the regulation says that?
Yes.
Could you please?
You can release payment information?
I would like you to give us the regulation
Sure.
so we can give it to our HIPAA privacy attorney to verify whether or not that's a breach.
Okay. It's in 156. I'll send it to you.
Can you actually distribute that to the carriers notify?
Sure.
I think that's important for everybody to see.
Okay.
So let's.
I have a question.
Yeah, go ahead.
What if the premium is paid in full? Would it reset the grace period?
If it's paid in full for that point in time. So in this example, if you got to April, they would have had to pay the entire 3 months premium by the end of April, otherwise they'd be terminated. So if they pay 2 months or 1 month, they would be, even if they paid the 1 month to get that 1 month that was pinned or that was originally paid up to date, they are not out of that grace period until they have paid in full up to that point. So they're in the grace period for, in this example, February. If the premium was $100, if they paid $100 in February, they're out of the grace period. If they didn't pay $100 by February, then in March, anytime in March, they'd have to pay $200 to get them out of the grace period, to be paid in full at that point. And then in April, to get out of the grace period, they'd have to pay the full amount. So at that point, it'd be $300 to get out of that grace period. If you don't get out of the grace period by paying that full premium, then at that point, and at the end of that 90 days, it's for 3 months at that point, then you will be terminated retroactively to the end of the first month of coverage. So.
Okay. So.
Go ahead.
Okay. So in April, if they paid in full, they become current, and then they start getting delinquent again in June. Would it start the clock again from grace period of day one? Or would they not have any grace period at all because they have burned it earlier and they'll be turned right away?
No.
That's what I'm trying to find out.
I didn't consider that, but I think if I can recall from the regulations, basically your grace period would start up. So once you're paid in full, and then you stop paying a second time, your grace period would start over from the due date of that bill of the next one that you missed.
Okay.
So it's not cumulative over the year. There are new grace periods every time you pay in full, but you can't get out of that grace period until you pay up to that point in full. That's the APTC rules. We got a little bit different rules for shop and individual non-APTC. And based on the concerns from the carriers about 3 or 4 weeks ago, we said, okay, we hear you. We want to make this right. We don't want to create a huge risk for you guys. we realize that the APTC side creates a risk for you guys, but we can't get around that. Those are federal rules. On the shop individual non-APTC side.
So on the shop individual non-APTC, shop employers and individuals without APTC will be provided a 1-month grace period. Premium is not paid in full by the end of the grace period. The employer or individual will be retroactively terminated to the last day of the month in which premium was paid in full.
I think that's consistent with today's practice?
Yes.
Yep.
Yes. Great.
Can you define months? Is that 30 days, 31 days?
We're referring to the calendar month in which it occurs.
Okay, thank you.
It would go back to the first of the month if that's the effective date.
But the grace period.
The grace period.
Right, from the...
Yeah.
The grace period is 30 days, though.
Correct.
So yeah, so that should say 30-day grace period.
Well,
is it, or is it 1 month?
What we're doing is we're saying 1 month because each month is different, but because it's due on the 25th, we're going to actually go to the end of the month for processing time. If it's not paid by the end of that following month, then we'll terminate retroactively.
Right. So if you'll notice, I did a little sleight of hand. I said that the bills are due on the 25th of the month prior to the effective month, the date of coverage. So the February bill is due January 25th. So basically we're going to say, so then February 25th, the grace period expires, but we're not going to terminate until a couple more days. Now that doesn't make a difference at that point, but if you're looking at the March bill that's due February 25th, because February is a 28-day month, then while we're going to say the grace period expires on March 25th, we're not actually going to send you termination until the end of the month. So we'll always send you the termination just prior to the end of the month. We're going to make sure that there's the full 30 days in there, but that I think the intention was to provide them the termination prior to the start of the next month.
Right. So there's other concerns regarding pending claims for non-APTC. So one of the discussions we had was regarding the full file that sends the pay-through date. And so if we were going to not terminate till after the due date, which was originally on the 1st of the month of coverage, then we would not be able to coordinate that file, any pending payments that were sent directly to the carrier that need to be transferred over, anything in transit. So what we did was we said to try to accommodate that, if we made the bill due on the 25th, that gives all the transit time for payments that were sent directly to carrier that need to be sent to the exchange, or payments that we haven't processed yet through our online process or through check mailing. We could process all of those payments. Everyone would be paid up in full as much as possible based on the due date of the 25th. And then when we send that full file at the end of the month, that will allow the carrier the ability to, if they choose to, pen claims for that following month if payment was not received for that month, to limit the risk on the carrier. And so that was a discussion.
I have a question. Are you expecting a zero tolerance policy, so they have to pay 100% in full?
That is correct.
Thank you.
So are there any questions or concern about that? We're hoping to address the concerns that came up in previous discussions by applying that policy. So we hope that addressed those concerns.
Go ahead.
Sorry, if I could ask just a scenario. So if they sign up for a January 1st effective date and they never pay, you're going to send them their first late letter?
No. So you cannot enroll in coverage without paying us first.
Okay. Let's say they pay for the first month.
They pay January.
Through January.
Okay.
You're going to send them a late letter on February 25th, correct?
January 20th.
No.
February 10th.
Right now, pay for January.
No. So the February invoice will go out on January 10th, due January 25th. If we don't receive any payment by then, we will send the late notice on February 7th. Is that right?
Correct.
And then it will be, the grace period will have expired February 25th.
And then if they don't pay, I guess by April 25th, we would turn them back to February 25th?
Oh, okay. So I thought you were, so
He's back on the individual.
ABTC. So because there's two different rules for ABTC and non-ABTC. You're on ABTC.
Yeah.
So
the 25th does not apply to the, I apologize, if that doesn't apply to somebody with an APTC.
It's to both.
Same.
It's 3 months.
But the I think our intent would be to make the termination date would be the end of the month of the first month of the grace period. We're not doing any proration of months. It's all or nothing for a month.
So slides 10 and 11, the next two slides in the deck, are flows that walk through kind of the exact scenario where you set out when the invoice is due, when the late notice is sent, when the payment is due, when the communication is transmitted, and then when they would be retroactively terminated.
But when you say the end of, that doesn't mean the 25th, that means the 31st, 30th, or 28th.
The end of the month, yeah.
Okay.
The last day of the month.
This is Lori from United Healthcare. I have one question.
Go ahead.
On the transaction from the EDI 834 for the non-payment, is that coming on the monthly 834 or the daily?
Was it regarding the termination? The termination.
Yeah, for the
the termination would come on the 834. The daily 834.
The daily.
Yeah.
Thank you.
John, was there an estimate anywhere about the flux in the subsidized plan? In other words, assuming that there was 10,000 people that were in the exchange, was there ever an estimate about what portion of that population for the subsidized group would be in potential non-payment at any one period of time?
No. Well, and the regulation for this 90-day regulation, I think, came out in November, December, something like that. I mean, we haven't. I have no idea how many will be in non-payment. I have no idea how many people will be in exchange, for that matter.
So I'm just looking for a percentage that's going to be a non-payment. Your other reason for non-payment is someone's become eligible for group.
Yeah.
Right? And then technically, if you have to keep them enrolled or paid for that for February, right? Then we have the issue about whether or not the individual can coordinate with group. And I haven't made it through AB 425 to see if the state reversed that law, but today, group can't coordinate with individual.
Well, if you are enrolled in group coverage and affordable minimum essential coverage, or if you're even eligible for it, you're no longer eligible for APTC.
So you're going to terminate those people back to January for the sake of
Yeah, that is if we know about it, right? We can only go with what we know. But assuming that we know about it, if they are eligible in this case for group coverage February 1st, it's no longer a grace period, non-payment grace period issue. It's they are no longer eligible for coverage, and they should be terminated effective January 31st.
And you're going to send us that information, so we will have a different termination reason.
Yeah, as soon as we know about it. I mean, if we know about it, right? I mean, if we don't know about it, it would appear to us to be a non-payment issue. If we know about it, then we will send that information to you on the daily file.
Because I think that's important because we're not going to pay claims.
Absolutely. And so we may not find out about it, but you could find out about it in your claims because the form says, do you have any other insurance, right? And you say, wait a minute, they got another coverage. You can let us know and we can terminate them appropriately.
No.
No?
They never tell us. No. Wishful thinking.
When the health information exchange comes up, right?
Yeah, we have to validate it against any available source, and eventually the exchange will have its own data pool that it can validate shop versus individual guys.
Yeah, and now if we have that information in the exchange, it'll be if it's a shop employer that makes sense, But obviously there's a lot of other sources of insurance out there, so.
All right, want to move on?
Before we go on, so for partial payment, you guys don't accept partial payment at all? If somebody has a $100 premium and they pay $99, you say, too bad, you're out of luck, you're terminated.
Isn't that right, Paul?
Well, depending on the situation, but yeah.
And those on the phone, Nobody accepts partial payment? Does anybody accept partial payment? Ever?
No one wants to answer.
So
we do. We have like a tolerance level where we do accept, payment. But again, it's not multiple carriers and multiple health insurance products, so it's a different world.
And so a partial payment, for this 90-month
Like we have a tolerance level that says you have to accept. We'll accept it if it's 92% of the premium or something like that.
And it's a group of X size.
Exactly.
And so in the Wizard of Oz world of the ACA, where there's a 90-day grace period, and they're in that third month and they pay 250% of a month premium, so they've caught up 2 months, but it's a partial payment for the full 3 months. Is it the carrier's recommendation that we reject the entire amount?
So you just said they paid 100% plus 2 additional months. Is that what you just said?
What I said is they paid 2.5 months. So if their premium is $100 and they're in the third month, they pay $250. So we will have to terminate them for non-payment because they didn't.
And that's how we would want that handled, since they're required to pay all 3 months once they go into delinquency status, and you have a 0% tolerance. We would expect 100% payment in full.
So if they did not pay 100% payment, you would expect us to reject the payment?
Yes. We would expect that. From an insurance carrier's perspective, we do not expect to receive it unless it's 100% paid in full.
So you're just to confirm, you're saying you would not want to receive those 2 months of premium, one of which you have to pay claims against, the other one which you could pen claims. You do not want to receive those payments and leave that individual active for the purpose of ATPTC payments from the feds. You would rather not accept those funds, eat the claims for the first month, and pen claims for the second month.
And eventually
terminate the member.
Back to the first month.
You're still going to terminate if you accept 200% and leave the other 50%. I think that's really the problem. The problem is what does that money get you? Does it get you through the 15th of the next month?
No, it wouldn't get you that last month.
I'm being facetious.
Yeah.
So, but what does that person think? Do they think that I can keep stringing this along, right? And it's not a question of whether or not we want to take care of people. It's a question of sort of human behavior that thinks that they can get by with X, because I'm going to assume that if we said, okay, we'll accept that payment, then you're going to say to that person, okay, your grace period is over, you're done May 30th, and if you thought you partially paid for June, have a nice life. I think that's what we need to understand from your perspective. How long does that partial payment restart that clock, or are you going to say, okay, here you are, this is the end of your grace period, you paid these 2 months, you've partially paid for the third doesn't count, we're done. I think that's really the issue, because we just don't want to be strung along. Because the concern that we have is that I have anyway, is that people are going to pay as long as they're sick and then they stop. We've seen them game the small group market by creating small groups and have pre-scheduled surgery somewhere, go for that, and then term 2 months later when they're feeling good. So I think that's really what my concern is when are you going to draw the line?
Well, and so we thought we drew the line, but there's suddenly a concern about partial payments that.
Well, so the way we handle partial payments in our world today is that, so if someone pays short, we will send them a short pay notice. So, and I think that makes sense, and especially since we're saying you have to pay in full, otherwise you go into delinquency status, right? So if you're a penny short, you're going to go into a delinquency status. And if you don't pay that penny by the end of that month, the next month you're going to be retroactively terminated, and we're going to return all your premium minus that 1 penny that you were short. So the appropriate way that we feel that should be handled is that if they pay any amount short of the premium that is due, we send them a notice that says, hey, you paid your premium, but you're short, which puts you in delinquency status.
You paid part of your premium.
Yeah. You paid part of your premium. And you need to pay the remainder premium, otherwise you will be terminated retroactively. For the APTC discussion, I would say that we should handle it the same way in regards to if they're in that third month and they pay 250% of the 3 months, so they pay 250, they're short, we send them a notice saying, hey, you paid, which gets you through, in this situation, February and March, but for April, you haven't paid, you're still in delinquency. If you don't pay for that April premium, you'll be retroactively termed to the end of March. That accounts and communicates to the customer for that month that they pay partial, and it gives them a clear message that you will be covered for these months, and you will not be covered for the month that you paid partial.
But you're not going to extend the grace period.
Right.
So the check has to come in, for the sake of argument, by April 30th, or they're terminated till at 3/31.
Correct.
It also creates a consistent policy between APTC eligible and non-APTC eligible individuals, which is if at the end of those 30 days, regardless, if you don't pay, you're still short paid, you're retroactively termed to the last month of payment. APTC or not, the difference being APTC, you technically have 2 more months that you could make that payment in full.
And you still have to have coverage
Correct.
at the end of the first month, regardless of whether you made payment. All right.
Okay. All right, so we're going to move on to slide number 12. And so this is an exchange definition of employer-employee eligibility. So section 155.20, a small employer means, and this is defined in conjunction with a group health plan with respect to a calendar year and a plan year, an employer who has employed an average of at least 1, but not more than 50 employees on business days during the preceding calendar year, and who employs at least 1 employee on the first day of the plan year. And we're quoting a specific citation there. We're reading the literal interpretation of the 50 employees as we go down below. Employee means an individual whom works a minimum of 30 hours per week or a total of 130 hours per month as attested by the employer, which means that part-time, seasonal, 1099 employees are not eligible for coverage through SHOP. Union employees not eligible for union benefits would be eligible for coverage, and commission-only employees must make equivalent to the state minimum wage and the minimum hours worked to be eligible for coverage. Now, part of the reason we bring up the issue with the employer size and defining that is that you may have an employer who, for the purposes of tax penalty purpose, has more than 50 employees using the FTE calculation rules and seasonal employee rules. So they may actually have an employed from a penalty standpoint 60, 65 employees. However, for the purpose of SHOP, they have less than 50 employees who meet that definition of a minimum of 30 hours per week or 130 hours per month, who would in fact be eligible to be covered through the SHOP. So that is how we are defining an employer and an employee in an eligibility for SHOP. Are there any questions in regards to that?
Yeah, I got one. It says part-time, seasonal, 1099 are not eligible for employees. I'm an employer with 20 employees and 3 part-timers. I can't cover the part-times?
That's correct.
We heard you say before, John, that you could cover the part-timers.
We've been working through this, trying to figure out what is appropriate. There's a couple of weird things that happen with this. The eligibility for SHOP is a group of 50 or fewer full-time employees. So if I have 45 full-time employees and 100 part-time employees, I'm eligible for SHOP? Am I still a small group? I think you would say that that's a group of 150, 145, and that would be a large group.
Let's go back to 20 employees, which clearly is a small employer.
Yeah.
And you got 3 part-time employees. You cannot cover those 3 employees?
Well, so the other side to that is that if you have an employer is not required to cover part-time employees. And I know we're talking small group, but a large employer is not required to cover part-time employees. Those part-time employees, because they don't have access to minimum essential coverage.
The employer is not required to cover any employee, regardless of size.
Okay, a small employer who has 45 employees, but 150 part-time employees.
I hear that argument. That's our full-time equivalents, whatever. But the question is, the way this reads, you got clearly a small employer, 10, 20 employees, nowhere near 50. And you have part-time employees that says they cannot be covered, the part-timers. And the part-timers are working, 25, 30 hours a week. They're not full-time, 25 to 29 hours a week. You cannot cover them. You cannot elect to cover them.
It is difficult
in the world today. You can't.
It is difficult to provide standard rules, and I have to go back to the example that I was providing. 45 full-time employees with 150 part-time employees is a large employer for the tax penalty purposes.
I understand.
And they will get penalized if they don't provide coverage to their 45 full-time employees, but not for their part-time employees. If we offer them coverage on the SHOP, if we say that employee can have coverage on the SHOP, and we say part-time employees can be covered on the SHOP, now we're talking about a group of 145 people, which my understanding is not a small group in today's market.
It is a small group in today's market.
So carriers provide small group rates to groups of 145?
Well, there's a difference between eligibility.
Different information
there's
every
a,
day.
There's a difference
This is
between
completely different from what I was told 2 weeks ago.
How
So
you
not
determine
from the DUI, but
how you determine what a small group is something very different. I know we had some custom products that came through with the economic times that we've been in, where there have been some employers in Las Vegas that wanted to make employees that were on call that in better times qualified and worked a 30-hour work week, so they were actually not making it. So so there's a difference between, is it a small employer or not? Once it's a small employer, then it's up to the carrier whether they want to accept an employer that wants to extend to part-time employees.
okay, so that's where we have to figure this out. So which carrier here is not, or is there a carrier willing to cover part-time employees? And if so, is the threshold 25 hours? Is it 20 hours? Is it 10 hours? Is it 5 hours? Is it 1 hour? Got my uncle, 1 hour, he works 1 hour for me, so I want to cover him as a part-time employee. What is an appropriate standard for all the carriers on the exchange, because it's going to be uniform? We're not going to make different rules for them.
From a perspective of not violating any trade secrets or anything else, I suggest you get each carrier to respond to that individually, not publicly.
Okay, so if you want to provide us input to this, get back to us by the end of today. Otherwise, no part-time employees on the SHOP.
Because you have to decide what your group size is and how you calculate your participation as well when you start looking with full and part-time employees, because it changes.
We realize that.
This is Susan Robert with WellPoint, but we agree with your, because it follows the FFE model.
The model is no part-time employees?
Right, 30 hours. They have to work 30 hours or 130 hours a month. So we agree with your, the way you have it written. and it's consistent with the FFE model.
So if any carrier has a contrary opinion about this, please let me know by the end of today. Okay, next.
All right. Normally we have an open Q&A, but we didn't actually receive a whole lot of submitted questions. We had some come in from some of the dental providers, specifically around the network adequacy. I think we talked about that as we started the conversation in regards to that, and that those standards we posted, I believe, John, you stated by Friday. So at this point in time, unless there's any other open questions, we're just about at time. Just a quick recap of our next two meetings. May 8th, we'll be talking about fulfillment, plan collateral, ID cards, kind of the communication side of it, followed up with a customer service public education discussion on May 15th. John, any closing comments?
No, thank you guys. Appreciate the participation.
All right, thank you, everyone.
See you next week.
Isn't this fun?
Oh, yeah.
You should be called Gumby, Elastic Man.
Yeah.
Elastic Man, isn't that a superhero? I think when my son was little.
So,
what would be your preference for the APTC folks?
I think the thing that scares me about it is that we've been played before, and I think every carrier's been played before. So, you know, when I asked you about the data service, I have a concern, because I'll be honest with you, what happens, a claim comes in, all right? And we hold claims for how many, after we adjudicate, how long do we hold them for?
It depends on when they're received and released by 22 days.
Yeah, 22 days. So we adjudicate a claim, all right? When it comes in, and say it comes in within 7 to 10 days after the date of service, depending upon the provider.
Right.
Okay, right? So we adjudicate, we hold for 22 days for that date of service. We receive notification from you that that person's no longer effective, right? You said we have to pay claims. You said we have to pay claims or we have to adjudicate claims? Because honestly, I mean, I would go in and I'd specifically look at if we could change the hold on the claims for this particular membership to 30 days, you know, or so we drop it to day 29. We drop the checks at day 29. And I don't know whether or not even Wendy can do that.
Because it's all at the provider level, not.
Yeah, right. Well, we have to figure it, but we do that to avoid getting hit. I mean, I think that's what people are going to think about. You know, is it adjudicated, is it pay, and then when does it come in? So, a lot of times, especially out of area, they don't even know who the insureds are. So we have somebody that's technically covered. We have to pay claims for this period. So we get this claim before, you know, we get this claim outside for this limbo period outside the date of service end. We already know that they're not effective.
Well, right,
you know,
so if somebody terminates coverage on June 30th, and in September, you get a claim for June 28th.
We deny it. As long as, right, we deny it.
The service was rendered in June and you deny it, they're covered for that.
Oh, no, we pay for it. I thought you meant, all right.
It's based on date of service.
We cover it if it's a planned benefit.
Right, right, I understand that. If it's an eligible.
Right, at that date.
If it's an eligible claim, you pay it based on the date of service. So why would this be any different?
What I'm suggesting is that we have to pay for the first, you said we have to pay for the first 30 days. This question of whether you have to pay for the first 30 days when you don't know whether or not that person's going to be retroed back.
Right, but that's a federal regulation.
Right, and you're saying that they're always eligible for that 30 days. So if the last payment is January 31st, that's the last date's paid, and they receive services in February, all right, and I get a claim in April, I have to pay that February claim.
By the
Are they
regulation,
eligible? Are they eligible through the end of February? Or are they terminated back to January 31st if they don't pay?
So the question is, and we brought this up, is it a term for non-payment or another reason? If it's a term for non-payment, they are an active, eligible person through the end of that first grace period pursuant to the federal regulations. Now, something could come in that says that they got group coverage effective January 31st and they're no longer
So
a person.
they're effective, they get 30 days free regardless.
They do.
On APT.
On APTC. Now, and you know, and when we first brought this up, we said administrative simplification, we're gonna make it the same for everybody, and you and everybody else had a fit about it, and that's rightfully so, right? It adds premium costs, and you're not getting anything back for it, right? So we said, okay, let's go back, we'll do state law, 30-day grace period, and that's it, right? And I think, so the non-APTC and shop side is just like normal business. We're not saying you have to pay claims for that, for those folks. It's for the APTC folks that you have to pay claims, and I can't get around that. That's federal regulation.
How about how aggressive, how, I understand you're gonna send all the stuff out and you say we would interpret it, but it's not your money, okay? So how aggressive can the carrier be for collections, or we just have to, you know, assume that
Trying collections for premium?
If we've been notified, are they a member to pursue premium collection?
I don't know.
It could create some confusion, but I mean, other carriers have addressed that too. Can we send our own notifications if we haven't received premium, right? There's nothing that says we can't. I'm just concerned about the fact that it may cause some confusion unless the notification specifically says.
But you're talking collection for premium, so this is after.
Post-termination collection.
Post-termination collection, right? And I think from our perspective, they've been termed.
Oh, I didn't get that. I didn't. So post-termination, we're not doing collection.
Right, you're not doing collection for premium, but can I go back for that 30 days that I had to keep them and try to collect that premium?
Yeah, they can. There's no reason why they can't. It's the covered month and it's due to them, so.
I'm asking.
I don't see why not. I can't recall if the regulation says you can't.
They'd argue that they want to be reinstated though.
No, because they haven't met the 90-day. I mean,
No, but I mean, that's the argument we would get is, oh, I'm going to give you this. I mean, why would they give us the money unless they thought there was going to be a chance to be reinstated?
Well, they were covered for that month. They were covered for that 1 month. That's the month we're talking about.
So why would they ever want to pay us?
No, they wouldn't. So it'd be up to you to, business rule, decide whether or not it's worth it to go after them or not. Now, theoretically, you got the APTC, so you got a big portion of it. I mean, that's not any consolation, but you got some of it. But, all right, so then my question, we've been back and forth about the partial payments. I mean, umpteen times, with you guys, without you guys. You guys never accept partial payment, period.
If the group is big enough, I mean, I think that's really the issue.
And I think besides that, partial payment is a different subject on group insurance, because a lot of times, the reason they send us partial payments is because they've had retro terminations or something, and we're not gonna have that so much in this. So, we will accept partial payments for that, right, Tammy? Like we just did today, right? So again, it is the group size. In our larger groups, we give them more leeway than we do our smaller groups. But I agree with what Cliff said earlier, that this could be a problem if we accept partial payment. Because the person could think, say, we'll use that scenario, $100 a month, and they paid $250, they didn't pay $300. They may think that they're getting coverage for that first 2 months, and we're refunding that third month. And I kind of think that too, Cliff.
But that's what we had. That's what we said in the presentation. That's what we were going to do, and that's what other carriers had indicated that hey, if they're going to give us a premium, let's get the premium for it.
Yeah.
I think an attorney would argue though that you've changed the terms of the termination notice by accepting the money, and you're no longer on the same basis. And now you've accepted money, so that termination notice has been altered.
Right, and so now it floats forward, right?
But it doesn't pursuant to federal regulation.
Right. But could we do this? What I'm thinking of is if we could make a policy that says we'll refund everything except that first month, because we're paying claims for that.
That's what we had last week.
Yep. Right. Right. I know, but you know, I'm just thinking of it that if we took that first month where we're paying claims, then we're not setting